This is Tom Biernacki, and today I'm going over gout. This is something I see thousands of times, very misunderstood, very misdiagnosed. I'm gonna go over all my secrets, the best treatments, the best home remedies, how to know if it's truly gout, because there's a lot of mistakes people are making, and we're gonna go over the secret tips and tricks, and we're starting now. The beauty is gout is so common. It's known as the king's disease. Very rich, well-eaten people used to get it. But the beauty is we're all relatively well-eaten now. There's a ton of sugar in our diets. There's a ton of junk, a ton of processed food. So we're living like the kings of England of 100 or 200 years ago. Stop this super painful disease. Gout is usually diagnosed based on the symptoms and medical history. So when somebody comes in, 99% of the time that people are told something's gout, it's not really gout. The real trick with gout is when you drank some beer before, when you fit the demographics. So, I mean, you're a little bit bigger, you're a little bit older, you've maybe had a gout attack before. Wake up and it's like 10 out of 10 pain. I mean, your joints are swollen, they're painful. Most of the time it's not gout when I see that. I would take an x-ray, some imaging, but you won't be able to do that at home. Always consider these top 5 causes of big toe joint pain. A bunion, this could be on the 5th toe or the big toe joint. This is stretching and pain of the ligaments. Hallux rigidus is arthritis. There's 4 stages. There could be bumps, there could be swelling. It makes gout more likely. Turf toe is the stretching or straining of the ligament. That could happen. Gout is uric acid crystals built up in the joint, and sesamoiditis are the bones underneath your big toe joint. We've got guides for all of these, so check them out below. A big tip is that it's usually just one side, not both sides. Gout is a breakdown product of DNA. That means any food or meat you eat, this could create uric acid. And it deposits in joints if you eat too much and your kidneys can't get rid of it. It usually builds up in the big toe joints. It can build up in the fingers, in the hands, and this is usually because you're getting larger or your kidneys can't excrete it enough. But it can happen in your spine, your ankle, your big toe joint, your knees, pretty much any joint in the body that has fluid. There are some great tests to make sure what you have is gout before you start treating. What it really is have you had a gout attack before? That's the single number 1 predictor. And number 2 is if it's hurting and gradually getting worse over time, it's probably not gout. The stuff in this video will help quite a bit. What we would do at our office is check the blood levels for uric acid. We could numb up the area and use a syringe to actually check if it's gout, because inside the joint it actually looks like crystals. You know when you put too much sugar in a glass of water, that's what gout looks like. It sinks to the bottom, but your joints are now the bottom, and that crystal slices up your joints, slices up your cartilage, and causes damage. Sometimes when I do surgery, it's kind of like cottage cheese pours out of there. The goal of treating gout is to immediately reduce the pain and inflammation. And then number 2 is make sure it doesn't come back. But you're probably more worried about the severe pain. The pain and inflammation attacked with gout is those crystals in your joint. You have to get some more blood flow in there to flush them out. And then we have to correct the underlying causes, which are medications, lifestyles, and we're going to talk about the best home remedies, because that's why you're really here. You don't want to go to the doctor. That's why you're watching me. Medications I would start with. Things that work really well are anti-inflammatories like ibuprofen, naproxen. These can really help. There's indomethacin, which is a doctor prescribed stronger one, but you probably have ibuprofen, naproxen. Those actually work to the area to lower the stress and pain level. Tylenol, on the other hand, helps your brain feel less pain. Whenever I tell patients to take medications, it's never for a long time. Always check with your doctor, number 1. But number 2, you can take ibuprofen, which is an anti-inflammatory, because that's processed through your kidneys, and you can also take Tylenol, which is processed by your liver. So those 2 don't add up, but be aware of toxic limits and contraindications. One of my favorites is a medication called colchicine. Colchicine is old, and there's newer ones now like Colchris. These are ones that I would prescribe my patients so they have in their medicine cabinet. You just take one of these, you can take some Tylenol, you can take some ibuprofen. That's a great start. The strongest big gun is if you get hit with severe attacks, corticosteroids are a great option. So if you're like, man, nothing's helping, steroids are kind of the big gun. Steroids, it's not something you want to take for the rest of your life though, because they can raise your blood sugar if you're diabetic. They can do some pretty negative stuff if you continue taking it. A great natural remedy for joint pain and gout is turmeric. These actually show to work just as well as anti-inflammatories, but if that's not working, colchicine, indomethacin, ibuprofen, anti-inflammatories, and I know I showed steroids as an injection, but really the best way to take them is in pills. The steroid injection is just a little bit safer for your whole body. That's why it was shown earlier. Now, longer term medications are called urate lowering therapy. These are medications like allopurinol or febuxostat. These are ones that if your attacks kept coming, so if you're like, man, I can treat them when they hit, but they keep coming like every week, every time I eat some bad food or some meat, these just keep hitting me. What you want to take is potentially some allopurinol, get your kidneys assessed, get a blood panel on your kidneys, and make sure things are not coming back. Now, lifestyle changes too. You're getting older, your kidneys don't work as well, you don't process uric acid as well. You want to lose some weight. We have a lot of great guides on weight loss. Eat a healthy diet. I have a great video that basically goes over all the top foods to limit gout. And you want to eat healthy foods, low glycemic index foods. This is really important to understand, the glycemic index, because this is what ties up your kidneys and your blood flow. Low glycemic index foods don't overwhelm it like high glycemic foods. And what happens is once you eat those sugars, that food, your kidneys are overwhelmed, and that uric acid in the bottom left corner here deposits in your joints. It's that simple. I like to use fruit as an example. Low glycemic index fruits probably won't spike a gout attack, even though technically they have sugar. But ones on the right, like eating a lot of watermelon, can overload your body with sugar. Now let's look at what good foods are for gout in general. You have low glycemic index foods, so like hummus, chickpeas, garlic, vegetables, eggplant. These won't overload your body very well. But as you get up into the 10 to 30 range, these foods also pretty good for you. As you get up higher, now these are more high glycemic index foods, which could start causing some issues. And as you kind of get up into that red zone where you have your processed foods, your snacks, all that kind of stuff, that's where you start having some problems. And right here you can see the white bread, the donuts, the baguettes, the white rice. Your blood and your kidneys are overloaded. Now you notice the meats, even though they contain DNA and purines, they're not the biggest culprits, even though that's where gout comes from. So even though meats and seafood do contain DNA and purines, they don't overload your body quite as much unless you're drinking alcohol and if you're not getting enough water. So hydrate and keep it moderate and don't overwhelm your body. There's a lot of patients now that talk about things like carnivore diet is good, even though, and I'm gonna get into this, is I go over this better in my top 7 foods for gout and top worst foods for gout. Here's the thing, some of the meats are technically high in DNA, which causes the uric acid leftover product. But the reality is, eating too much processed food, eating too much junk is the real problem. If you eat like one piece of lunch meat and otherwise you're healthy and thin, it's not gonna give you a gout attack. But what happens is if you're already overweight, you already ate a ton of sugary foods, and you eat like a steak on top of that, that's when the uric acid overwhelms your body. It's not from small amounts of meat that contain DNA products, it's really that overload. So don't feel bad eating this lean meat, because lean meat's not bad for you. The worst one is, here's what you gotta limit, your alcohol consumption as well. Taking alcohol in, it dehydrates you, and it basically ties up your kidneys, so your kidneys can't excrete that uric acid, so it deposits in your joints, like your fingers, your big toes, your ankles, and your knees. And then you gotta stay hydrated, drink lots of water. So if you know you're having a few beers, you know you're eating a steak or you're at a barbecue, drink a ton of water, keep hydrated as much as possible. Take a look at this food chart. Number 1, I forgot to mention, cherries are amazing. That's considered a good home remedy, as well as berries because they're antioxidants, but those are low glycemic index foods. On the right, these are still low glycemic index foods, but they have a lot of DNA and purines. But what happens is if you eat too much sugar and too much volume on top of that, your glycemic index spikes, your kidneys are overloaded, and that's what deposits that purine in your joints. home remedies. These are pain control. So number one, you want to lift up your foot in the air. When you lift it up in the air, that can drain some of that blood flow out of there. It can start feeling better. A lot of guides say to use ice, but patients report to me, this is so painful. Like if you put ice on a 10 out of 10 pain joint, you're having a ton of problems. What you really want to do is if your big toe joint's aching, you want to put it on your ankle so your whole foot gets numb, but you're not putting the ice directly on the big toe joint. You can also take a warm pack, a heat pad, like one of those lower back heat pads, or something warm, wrap it up in a dishcloth and put it on your big toe joint. That'll flush some more blood in there to clean out the joint and flush out some of that acid as the day goes on. With ice, the benefit is the ice actually constricts the blood vessels, but when you remove the ice, it shoots more blood flow in there. There's a lot of studies actually putting ice and removing it from your ankle after a few minutes sends more blood flow into your toes. And number two, there's actually medications that we can inject before the joint to flush more blood in there. I always think supplements like L-arginine or nitric oxide, these are workout supplements, but these would technically send more blood flow into the gout joint. So maybe having those on hand, tell me if those work or not, if anybody's trying those. But I would bet from a science standpoint, that makes a lot of sense as a remedy. And I include some of those options down below that improve blood flow. Epsom salt soaks. This is basically salt in warm water, kind of like putting a warm pack on there. You put your foot in warm water. That's gonna help blood flow move and circulate through your toes. It's gonna flush some of that crystal back into your bloodstream so that your kidneys can excrete it out. That can definitely help. And there's topical creams too. You can buy creams like Voltaren, capsaicin creams. There's a lot of pain creams out there. There's those CBD creams. I'm not vouching for those necessarily. Some of them are a ripoff. This is stuff you want to experiment with if you're in 10 out of 10 pain and you're going to the pharmacy anyway. Drinking cherry juice is a great option as well. Cherry juice can help reduce inflammation and lower uric acid levels in the body. The number one biggest secret is make sure it's diagnosed properly. Diagnosis is the most common thing. I see most people come in with gradually ramping up pain levels. That's usually not gout. Gout is when you go from like close to zero pain to going to severe 10 out of 10 pain, like, oh my, this is the worst day of my life type pain. And then secret number two is you've got to get to the root cause of this. Being overweight, drinking alcohol, your body can't handle the volume of fluid. Uric acid is essentially DNA breakdown. If you're taking in vast quantities of DNA, so that's meat, and sugary, garbagey foods that tie up your kidneys, your body can't process and excrete that. You can do two things: lower your intake of DNA, lower your body volume, or number two, increase the efficiency of your kidneys, which is not overloading them with alcohol, keeping well hydrated, moving, exercising, improving your blood flow to help your blood flow get that uric acid to the kidneys and excrete it. But this is the really big secret. This is not one you want to goof around at home. What you want to do is go see a doctor. If you're in Michigan, come see us. But colchicine tablets, indomethacin, steroid packs, these are the things you want to have available if you're prone to gout attacks. This is going to be severe 10 out of 10 pain that you want to treat properly. So don't just keep waiting. And for long-term use, if your kidneys aren't functioning properly, allopurinol might be necessary. But that being said, you have to lose weight, you have to get healthy, you have to eat all the right foods, because your feet could end up like this. Take a look at these x-rays. That is a disaster. It actually eats your bones. It grinds up your cartilage, leading to permanent arthritis. So you need to get blood tests. You have to get this stuff taken care of because it can lead to heart disease, joint disease, permanent osteoarthritis. This is not one to save a few dollars on. Lower the actual intake of uric acid and raise the excretion of uric acid. Drugs, food, everything can help. Check out our food guides and check out our other guides on gout. And check out our fasting guides, because that's what really makes the difference. Get healthy, stop gout forever, get off these medications, because there's ways to prevent needing them.